See if it will. I think it senses the light, but for some reason today it's looks like it's staying kind of dark.
No, it's fine.
It's fine?
Yeah.
Yeah.
Okay, great.
Of light.
Yeah, what's in there?
Picture of light. We have plenty of light.
She gets this over I didn't make
Put one
any.
on the steps for you already.
No, I don't want one of that.
Okay. Thanks, Mom.
Thanks, Mom.
Right.
We're not muted.
We're not muted. Okay, we can mute ourselves. Here we go.
Oh, I can do it. Maybe I can. Hold on. Okay, here we go. Okay, good. Feet pointed straight ahead. Take a moment just to feel your body. Where are your shoulders? Where are your hips? How is it in space? And then we're going to just really open up that upper back. So notice if you have one shoulder that's a little forward from the other. Go right into your elbow curls. Take your hands, fold your fingers to your palms. Bring your hands to your temples. Bring your elbows all the way together so they touch, and all the way back. All the way together, all the way back. And release. Shoulder rolls up and back and around, really moving the shoulder blade down into your middle back. As the middle back extends and starts to talk all the way to the low back. Maybe even into your glutes. As the upper back changes, it can help reposition the whole lower system. Good. Forward, back, and up and around. Squeeze and bring it up. And then back. And once again, rolling into that middle back, getting your shoulder blades to get low. And maybe you can feel that into your lower back. Maybe you can feel all the way into the outer hips or the glutes if you really get a big change. And into your arm circles, fold your fingers to touch your palms, bring your hands down by your side, squeeze your shoulder blades together and bring your arms up. Folding those fingers in, hug the shoulders to your spine, circle forward, 40 circles. Keep feeling like that whole arm bone is coming into the shoulder socket. The shoulder socket is moving into the shoulder blade, and the shoulder blade is moving into your spine. And then take a big breath and relax your belly so that your whole upper back can adjust to that. Try and drop them away from your ears a bit. When you get to 40, release and bring them up. Squeeze, arms super strong and straight, and backwards. And release your arms, come down onto your back, but bring your block with you so that you can take your block above your head. Feet on the floor, knees bent, reaching that block over your head. Just feel your body on the floor for a moment. Feet on the floor, knees bent brings us to about as naturally neutral a position as we can find. And then bring your arms over your head to your block. And I have my hands apart. I'm going to go right into that golfer's grip again. And I'm going to press down into the block. And that's going to fire muscles up at the top of the deltoid. Now, if you had any impingement here, then I would want you to go back to just doing pullovers and just allowing the movement to happen. If you're here and it feels okay to do presses, these are pullover presses, and you're going to press down into that block and feel what's happening behind your shoulder blades. So maybe my whole body just adjusted a little bit as I added pressure into that block, and then release. And do it again, press down and see if it's even. So as your arm comes up like this, the serratus anterior needs to kick in to pull your shoulder blade out to the side so that it rotates, so it still is held flat on your thorax. And then we're accessing more extensor muscles as you press your arms into that block. And if you hold for a moment, that will have an effect from the upper part of that shoulder all the way down into your lower back. Again, this may not be appropriate for everybody. If you do that and all of a sudden you feel that like zing or pinch right in here, it means we're not getting the shoulder blade to glide like it needs to. We're not getting that. So don't push through this. If you have pain in the shoulder right now, just wait. Or do some pullovers or some reverse presses instead. If it feels okay and it's getting more even, do 10 more press and release. See if you can let your neck adjust to that. And as your shoulder blades move more into your middle back, we're asking for balanced action between the two sides. Excellent. Go ahead and push your block away. And we'll stay here for a moment. Stay in hook line, bring your arms out to the side and go into your reverse presses now. Find your rhomboid muscles that pull the shoulder blades toward the spine. Squeeze them in and release. Squeeze and release. Squeeze and release. Finding the prime movers of what's supposed to happen. So make sure the shoulder blades are staying down and back. Maybe you can feel it adjust all the way down to the top of the pelvis. Repositioning the pelvis, neutralizing the pelvis if there was any anterior posterior tilt. the floor is just holding your pelvis stable right now. Good. Go ahead and grab your strap now. And make it so it's a fairly narrow loop and put your arms into that loop. And then just feel what your shoulder blades are doing now. Does one want to wing a little bit more than the other? How is the shoulder blade and the arm bone just relative to where it is on your back and on the floor? And then we're going to press out against that strap. So you're abducting your shoulder, finding those muscles that pull that shoulder, pull your arms away from each other, pull and release, pull and release. And if you're anything like me, there's something going on that's a little different between the two sides. I'm trying to even it out as much as I can. Press, release. And then just fold your elbows so that they're touching each, or fold your hands so that you're holding each elbow, and just bring one arm down to the side and up and over to the other side, just so that the arm bone and the shoulder blade are having to move a little bit together to touch the floor. And you might have to roll your upper back just a touch to allow that to happen. And then go ahead and remove your strap. We're going to go into a tricep stretch. Let's take your block and put it between your knees just to give your lower body some stability. And then take your right hand and tuck it underneath your right shoulder, and then make a square over your head with your left arm, and then just bring it underneath as far as you can. So it's going to pull down this whole side through the tricep, maybe down into some of these shoulder muscles and some of the side muscles, and squeeze the block with your knees just to hold some pelvic stability, and just breathe. In and out through your nose if you can. And then release out of that. Second side, left hand to your left shoulder, make a square over your head, and try to move that arm down your back as much as possible until you feel pull through that tricep, maybe down into the shoulder. Squeezing that pillow or block with your knees. So now we've had to have the shoulder protract, retract, move side to side, and rotate. And that should change what's happening in the upper back quite a bit. Go ahead and reach over, touch the floor in a kind of bent elbow pullover, bring it back down. Do that a couple of times, arm glide all the way up. Release the arm bone down, shoulder blade down into your middle back. Reach all the way up, glide, and down. 2 more. Excellent. Now, let's use that. Come back up to standing. And then come into a standing overhead extension. Interlace your fingers, flip your arms over, take it all the way up. Now relax your belly, relax your shoulders away from your ears, bring your head back over your shoulders and then look up, lifting your chin so that you're using your neck muscles into your upper back muscles. Once again, keep letting your whole body, belly go soft, finding those back muscles, pulling your arms back as far as you can toward the wall. Find length, elbows super, super straight. And release. And come into a standing quad stretch. So go ahead and grab onto one foot. You certainly may use the wall if you need something to hold you or a chair in front of you, something that would help to stabilize your body. But then press your knee down toward the floor. I'm going to go ahead and grab my foot with both hands so that both shoulders are being able to move back. Also, all that new space I just gained in my shoulders, I'm going to use that new space in my shoulders to talk to my hip. And as this standing leg is working, tuck your tailbone a little bit and really lengthen through that thigh muscle. We use standing quad stretch a lot for repositioning a hip that a hip in the wrong spot that maybe is degenerative. People who have arthritis in their hips, they always feel better after a standing quad stretch. We also use it to change vertical load or to make sure that muscles in the standing leg are firing like they're supposed to. So that vertical load between your ankle and your knee and your hip and your shoulder. And then go ahead and release that. And switch sides. Second side, take it up. Again, holding on to something or just working on your balance. Letting that knee go straight down to the floor. And tucking your tailbone just a bit so that you put a pull on that thigh. And release out of it. Now let's use that standing balance. Again, holding on to something is totally fine. Find a hamstring curl. So everything held pretty stable, that knee down toward the floor, curl that hamstring up 10 times. Trying to get your heel to touch your bum. And then switch. standing balance hamstring curl. Nice. Now, use your left leg and go a side leg raise. So find that standing balance again, taking your leg out to the side and back in. And then switch. Find that standing balance to get out to the side and in. Good. And then knee into your chest. Find that balance. Go ahead and grab that leg and pull it as far into your chest as you can. So that standing leg, you're essentially going into a unilateral hip position, one hip in total flexion, one hip completely in extension. And see if you can find that your body will kick in your butt muscles on that side, the standing leg, and this hip will get more and more flexion, shoulders down and back away from your ears. Hold it up there. You got this. You could hold the wall with one hand and hold your knee with the other if you need to. And then release it down and switch sides. Standing, pull it in. Find that standing glute. Flex this hip, shoulders down and back as much as possible. Let's do this one more time. Go ahead and switch sides. Down, that leg really rooted to the floor. Pulling this leg up, flexing that hip as much as possible, letting your shoulder blades move down and back away from your ears. And then just check out that glute, standing glute. Is it working? Are you in a position where that kicks in? Lateral hip. And switch. And release. Nice. We're going to go for a forward hang now. Tighten up your kneecaps. So lift your kneecaps up your legs and then go ahead and let your body hang over as far as it's able to go. Moving all the way over into a hang. Again, tighten those thigh muscles up. Lift the kneecaps. Keep them lifted. And then you may feel it through your whole back or torso as things start to let go. You may get more hip flexion as your whole body adjusts to that. Just go over and hang out there for a bit. Add your breath in and out through your nose. Feel more spaces in your spine release. Allow your belly muscles to turn on. Keep those kneecaps really lifted. Take 3 more full, big, deep breaths into your torso. You can just interlace your elbows and let them hang there. And then come on up. Nice job. Come down onto your back and let's do a little bit of abdominal work. Onto your mat, legs out straight on the floor. Now that we've opened up our upper back, take your shoulder blades down and back into that space that we found earlier. And then opposite arm, opposite leg. The same thing we just did basically in that standing position, except now we're using the floor and the floor is holding us stable and we can't rotate out of it. Go ahead and bring that up and down and then switch sides. All the way up and down, up and down, up and down. This time bring the one arm and leg up, whichever side you're on, and then switch at the top and switch at the top. That's 2, let's go to 20. 4, 6, 8, 10, 12, 14, 16, 18, 20. Both feet on the floor, pelvic tilts, rock it backward and forward. And then put the bottom of your feet together and allow your knees to drop out into a frog. Hands behind your head. We found this new space in our upper body, so let your shoulder blades, as your arms come up, take a minute to just take 3 deep breaths, letting your arms come up there. Full breath in, full breath out. Just allow the shoulder to adjust to this new position. Maybe you can feel how they can be more even. Check that your nose and sternum and belly button are in alignment. And then look at a spot slightly behind your head. Keep your elbows back and lift straight up. Little bit of a crunch and release. Let that shoulder blade move down again. Lift and lower. 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 And lift and lower. Keep going. Keep those shoulders back. We're doing this as much for thoracic extension as we are for just this little bit of abdominal work that we're getting. And then bring your knees in. And then take both legs over to the right side so that you're in a big twist with your lower body. And then 10 more crunches, lift and lower, straight up to the sky while your lower body's in a twist. So we're getting more oblique. And then other side, roll the legs over. Upper body open and lift and lower. And back up, and now onto your hands and knees for cats and dogs. How was that from one side to the other? Different, similar? All that is information for you to know how you can bring more balance to your system. Round and arch your back, letting your shoulder blades come into your middle back, into that new space, down lower than probably you normally could get it. Not so much up by your ears, but down into the middle part of your back. And then go ahead and do feet together, knees together, and sit back into a child's pose. And just bring your arms back behind you and take 5 deep breaths. So full flexion of all of your joints. And just feel, is it even? Let your shoulder blades completely fall off your back. Let your tailbone tuck as much as it will. And just breathe. You may even notice the rotation of your lower leg, that needs a little adjustment. In and out through your nose, big breaths, filling this space in your back. And then come up onto your hands and knees. And as long as this extension is okay in your body, come into a static extension position. Hands there, knees slightly back behind you. Allow your belly to fall down toward the floor, letting your pelvis roll over the top of your thigh bones. Squeeze your shoulder blades all the way together. Let your hands, your arms be like pillars. So elbows super straight. And then let your whole chest just hang on those pillars. And allow the shoulders once again to move toward your back body. And just hang out there. Breathe there. If you need to wiggle and make an adjustment, please do so. If that feels like too much on your back, you can just back up a little bit and go more in the shoulders and have less extension happening in the low back. Breathe and allow like taffy, like the muscles to move like taffy and open more space. Maybe even it turns an arm bone. You could do a couple of chest openers, which is the rotation of the arm bone in the shoulder socket, keeping the shoulders away from your ears. So don't let them slide up. The shoulder blade doesn't really move while the arm bone is freed up a little bit. And if you notice that that's difficult, or you have an arm bone and a shoulder blade that are just moving together and aren't being able to be separated, that's good information also. Few more rotations of the arm bones, and then gently come to neutral. Opposite arm, opposite leg, holding it out there. Find your balance. Release it down and switch. Lift it up. Release it down and switch. Just moving into that little bit of extension. And you could do this just with your legs. That would be a modification. Or take it back in, opposite arm, opposite leg, lift and lower. One more each side. And then once again, cats and dogs, round and arch your back. And then come to a seated position. And I'm going to scooch forward here. Well, we're going to go into a big thigh stretch. So this has really variable ways of how far people can go down. So bringing the foot along the side of your body and then go into this quad stretch. So your upper back and thigh muscles are connected in terms of if your upper back is stuck, the thigh muscles have a hard time letting go. The same thing as the upper back and the hamstring muscles, that whole system is connected. So you may just be here and work on squeezing your shoulder blades together. And maybe your body just wants to stop right here and just breathe into that quad stretch in this position. And that's plenty today. Or maybe you can take your body all the way down or somewhere in the middle of that and let this whole system open. And if you really want to go after it, that pullover press that we used earlier, you could take your arms up and press your arms into the floor. And as your upper back engages, it will literally open all of that space. So as quads, anything that's being held tight in that system. So choose what version of that you're in today. Give it a minute and a few breaths. And switch sides. And check your other side. So again, you might be one leg folded back and you might just be here. That might be plenty. Just to take the muscles that cross the knee and the hip and to fold them that far is asking for a lot of length. Especially if you're a cyclist or you sit in an office chair, those muscles often adapt to a shorter position. So being able to just recognize where they are and just be with it wherever it is. Open up your upper back. And then any version along the way that you're comfortable with. And if you've got it there, all the way up. And again, just noticing the difference between the sides. As you press your arms down into the floor, it really helps to open up that whole system. We're all connected from the thoracic back into the level of the pelvis, into what's going on at the quad. Find your breath, a couple breaths in and out through your nose, or at least in through your nose. Letting the diaphragm come back into space or work. And gently come out of that. And then both feet on the floor. Once again, pelvic tilts. Just use that to get the pelvis to move between the leg bones. And then lift your hips So shoulder blades gently tucked underneath you just a little bit and then relaxed. And then lift and lower your hips off the floor. After we've opened up the front of that thigh, now we can activate our glutes. And sometimes one of the muscles, like the tensor fascia lata, if it's too tight or taking over, then it's hard for the glute to activate. So hopefully after we just did that, we lengthened that whole compartment, front compartment. Now we can activate this posterior chain from the shoulders all the way down the lumbar spine into the hamstrings, maybe even calves, up and down. Let's go 15 more. And release. Find your butt muscles and just squeeze and release your glutes. Tighten them up and release. Find them. If it's difficult to find, you may stretch your legs out straight and activate them that way. Glutes are hip extenders. They take the leg behind you, and they also are part of outer rotation, external rotation. So sometimes it's difficult to find that glute when your knees are bent. But you can do it one way or another, feet straight or knees bent. Activate glute muscles. Relax your belly. Separate those two. Crush some walnuts with your butt cheeks. And then while we're here, so we're not ignoring some of the internal muscles, we're all the way in a really neutral position, and we worked on squaring the pelvis and squaring the shoulders. So now do a couple Kegels where you pull your pelvic floor up. And if you imagine that those muscles are like this, and they can act like an elevator, and you can pull them up to the second floor, and then you can drop them down toward the basement. Draw the muscles of the pelvic floor deep inside like you're stopping your pee. Draw them up and release and up. And you can see that those muscles are like hanging between the sides of your pelvis. And if you have one side of your pelvis that's rotated, then it puts a twist or a pull on those muscles and they don't activate well. So now that we've done all that work to get as square as possible, activating a few of those muscles, pulling them up and releasing. There's a lot of pelvic floor therapists that have associated back pain that can't be or hasn't been treated well with pelvic floor weakness, specifically on one side. So being able to square that all up so that they work well is also an important system in treating back pain. Okay, come on out of that. Come up to your air bench. Walk your feet out, slide down the wall, push your low back flat into the wall. Stay there, low back. You can even let your kind of low back round first. Feel the flexion happen. And then as each bit of it extends, take it up. And I've even been doing air bench lately with my hands behind my head and getting that whole thoracic extension to stay there and gently pressing my head back so that all the muscles from the back of my neck, that whole system, into the back of my shoulders, into the back of my low back, Then finding muscles at the base of my butt, those little glutes, a little bit of a squeeze, feel the hamstrings press into the floor so that your air bench isn't just in your quads, but in the whole entire system of your body. See if you can take a deep breath. Make your ribs expand even more. And release out of that and come to standing and check your body out. If we did a really good job today, then it should feel like your shoulders want to stay open. So maybe your shoulders hang out here normally, that they just want to be there without you thinking about it. And who knows how long that'll last today. These patterns are pretty ingrained, but as long as we can teach it to come back to this space every once in a while, that can make a big difference. So big deep breath, reach your arms up all the way over your head. Just feel that and release. And then come into whatever position, lying down on your back, legs up over your block, seated, whatever you would like to be in for your meditation today. So come into your position where your body can just be still. And I'm going to borrow an exercise that I found to be really helpful just to be in the present moment. So I'm going to use it today. So I want you to imagine that there is a little cabin, and that before you step into the cabin, you open a suitcase, and in that suitcase you put everything that isn't your beingness or your I amness or your just essence. So put into that suitcase your history, your name, your joys and traumas, your thoughts, your beliefs, and just pack them up and zip them closed and leave them outside of this space that you've created. And then I want you to step into that space and in that space You can notice your breath and the sensations that exist right now. And you can be with whatever is arising in this space. As a witness, as an observer, without doing anything or being attached to anything or going with anything. Just watch. This essence is timeless, but you can only experience it right now. Anything that's arising is arising in this space of consciousness without you doing anything. It just is. Once again, feel your breath. Feel the sensations of energy. Experience your beingness. Go ahead and take one more moment to experience this. If you want to stay here, you may turn off your computer. And if you want to go back and pick up your baggage, you're welcome to do that. It'll be waiting for you. Go ahead and gently come back around and we'll have a few moments to visit. And remember to unmute yourself if you'd like to say something.